And we're back, and we're moving into our first conversation for this morning. As we told you earlier, our conversation or show will start off with a conversation with Dr. Ellsworth Grant, who is an oncologist, and of course he is joining us live via Skype to tell us a bit about what cancer patients should be mindful of. Of course, he is one of the founders of the Dangriga Cancer Center. Good morning.
Good morning.
Good morning. Good morning. How are you?
We're so grateful that you agreed to do this interview with us. We know you have a pretty hectic schedule. You're still working in Los Angeles, right?
Yes, I am. Yes, I am. Although it's hard to tell you're in Los Angeles right now. This place is a ghost town.
Wow. So you have a mandatory lockdown in Los Angeles?
It's called a stay-at-home order,
Okay.
meaning that if you don't have to, it's considered non-essential things to do, then you stay at home, except if you have a dog, you can go walk the dog, go buy groceries, and go out and do the daily things to survive. But other than that, you should stay at home.
Okay.
For us in healthcare, there's still sick people to be seen, and that job never ends. So we still go off to work and see patients, and the only great bonus of a stay-at-home order is that there's no traffic in Los Angeles. It's a wonderful, beautiful thing.
I was telling you before, that in itself is a once-in-a-lifetime experience to get anywhere quickly in LA.
Yes, it is. Even at any hour, you can get anywhere in record time.
Don't tell us how fast you're driving now. So,
Speed limit.
So, Dr. Grant, of course, we know that you have quite a number of patients that you work with in Belize at the Dangriga Cancer Center. And we've been hearing repeatedly about the different vulnerable groups or high-risk groups for COVID-19, and cancer patients are one of them.
Cancer patients are indeed one of those groups. We give patients medications that can affect their immune system and weaken them a bit. So across the board, when you look at how patients are impacted by COVID, cancer patients tend to have a little worse time. However, overall, I would still say that when you look at data coming in, and the best data was from China, that fatality rate was about 5%. So I think there's still this idea that everybody will get COVID, and as soon as it touches you, that you will die. But although the rates are higher and the virus can be severe, but there are people who can survive the virus and do survive the virus, and the majority of people will.
Yes.
And I would also imagine that this situation must be constantly under review because it is, the data is relatively new and the situation is developing worldwide day by day. So are you also looking at, are you also keeping updated with the new data? Because I would imagine that it's a lot.
It's quite a bit, and every day I go and I look and and read, and there's a lot out there, and we do know a lot, but there's certainly a lot that we don't know, and probably the best answers to all of this will come after the crisis abates. But right now the situation is quite fluid, and information sometimes gets a bit loose in how it's translated, but it's still just trying to get the best pieces of information and try to put the puzzle together, recognizing that there is still a lot unknown.
Yeah. So is the cancer center still treating people in Dangriga?
Yes, we are still treating people in Dangriga, and something significantly different has changed. As you know, the borders are closed, and so our pediatric patients who I used to go to see Dr. Gonzalez in Merida for some of their care. That's no longer available to them. And so we have now taken over the entirety of pediatric care. And in consultation with Dr. Gonzalez, I think one of the things that we certainly did to make the cancer center work when it opened 11 years ago was to actually make use of telemedicine and via conversations such as this one via Skype or FaceTime. And so we continue to use that medium to get patients seen, recognizing that we're not there physically, myself or Dr. Gonzalez, but in this day and time, telemedicine has come to the forefront to offer people care that with a provider, expert provider, that they may not have had.
So how many new patients have you taken on since people can no longer travel across the border to get their cancer treatments?
You know, the numbers are still coming in, and it seems like every day we're getting someone contacting the center asking us to take over their care, and we're happy to do that. I think one of my only concerns are principally, getting medicines to the country, given that pretty much everything is closed off. But I think with some of the contingency plans we have in place, that we'll be able to ride out this crisis, and everyone should be seen, and we'll have enough medicines available to get everyone treated. And I really don't think we'll have anyone lingering out there who won't have access to treatment.
That's very comforting to hear, because that was the first thing that came to mind. Would you have enough of the treatment? Because I know you would usually send it from where you are.
Yes, and it was close, but we made it. As I said, it's in some of the things that came to pass. I anticipated some of the things that would have happened, just given the fear from the pandemic, and so we were able to try to project into the future the things we would need, and to get them in clinics so people would have access.
I think that feeds into what was going to be my next question, and what I'm sure is on a lot of people's minds, especially if they are receiving treatment or if they do have a history of cancer. It's how best they themselves should prepare for the pandemic, or what preparations they should be making as we know that the COVID-19 continues to spread. So if you are a patient, what would be your advice as to what they should be getting in place?
I think mostly it's trying to remain isolated as much as possible, and I think that becomes difficult because you generally rely on access of family members and others to assist you during a time of need. And I think when you look at vulnerable patients, cancer patients, the elderly, that vulnerable population really needs the younger folks to carry out some of the missions of of isolating themselves, and not to bring anything home that can infect these vulnerable patients. And so although you may have a lower risk, you need to consider the person at home next to you who may have a much higher risk. Understandably, some people, given circumstances, won't be able to isolate, but number one mission is to try to avoid those who are out in the population as much as possible.
Yeah. And there's the added layer of exposure for people to travel to Dangriga. on public transportation to get to the treatment center.
Yes, the population is definitely one that's out in public, and I would make an appeal to to those who would be able to transport patients so that they would avoid public transportation to please, this is a time to offer people help. And if additionally, if you certainly feel sick or believe that you have something, please do everyone a favor and stay at home and not expose yourself, because typically by the time you have even more symptoms, you would have already infected even more people. So although people always say I feel fine and I could still go do this, but if you are experiencing symptoms, then you should just stay away.
What added level, because to be clear, once someone gets treated for cancer, they're already very exposed to any illness because of what the medicine does to their body. What added layers of protection or prevention have you been communicating to your patients?
It's in patients who receive chemotherapy, it all depends on what you're being treated for and how much therapy you get, and your immune system certainly can be compromised, and in a way more so that you will, whatever it is that hits you, you're more likely to get it more severe. Whereas somebody else would weather the storm a lot easier, and some of the populations where we really have to lower their white blood cell count quite a bit would tend to be more vulnerable. But in general, it's just trying to keep people as well as possible, so that whatever comes their way, they can weather that storm, although they may be more at risk than the average person.
How concerned are you for your patients in Belize?
Oh, quite concerned. Quite concerned, and I think our staff of Sister Gladden and Paulina Colo have done a wonderful job and continue to do amazing things, and we need to keep them healthy. So please stay away from our nurses. We need them healthy.
Yeah.
And we have instituted additional cleaning measures in the center. We have provided masks to patients to help them out when they're in public, and providing them with education. It is a time of great concern, and with some hope this will all abate in a short time.
Absolutely. Now, you mentioned the people that you have. I know Nurse Obi that is there, and you have a couple other staff members. Have you added restrictions in who can visit the center along with the patient?
Ideally, it should be one accompanying person, and the fewer people that come in, the better off everyone is, and it's not being
Adhered to?
Iron-handed at this time. It's just best for everyone that people have less access, and the fewer people you have, the smaller chance you have of transmitting something to someone else who is vulnerable. And I think sometimes it's something difficult for people to get, but we're just trying to do our best to keep everyone healthy and around for a long time.
A lot of times when you talk about cancer, it's nothing like COVID, but one similarity it has is that sometimes you may not know you have it. And it's very difficult to communicate health messages to people for illness they cannot see, or for them to take the correct action for illnesses they cannot see. What have you found to be effective, even in the work that you're doing there, to get people to understand the risks that you have in contracting it and more so spreading it?
You know, I think people are aware, and they, are frightened. And I think some of the things you don't really need to communicate, because the patients already get that they're at risk. I think it's really trying to look at the population at large who haven't seen anything like this before, and have them understand that they have a greater role in protecting the health of others. And so while you yourself may not be in a high risk group, your mother, grandfather, uncle, aunt may be in a higher risk group, and your activity can really place them at risk. And so you bear the burden, although not for yourself, but you bear that burden of impacting family members.
You know, as a healthcare provider, I'm sure you watch all the coverage that's taking place, you hear what people are saying and see the different messages. There's two extremes. You have where people are complacent, and you have people who are panicked. What's your message?
I think the panic is really related to the unknown, and I think sometimes people don't really look at the sources where the information is coming from. And education always remains a powerful thing, and unless you really look for yourselves at credible sources, then you tend to digest a whole lot of garbage. And so I would first say, find credible sources where you can really believe the information, and that someone is not trying to to have gain from it. The part of the panic is really from people believing that, and getting the impression that everybody will die from infection of this virus. And while some will die from infection, the majority of people will do well. But part of them doing well is listening to what people are saying, and trying to follow some of the recommendations coming from the healthcare people. We may look back at some of the things and say that, we didn't really need to do that. But at this point in time, we don't know that. And whenever humans are confronted with the unknown, they tend to panic, and it's a natural human reaction. But I would say to take time out whenever you hear something, and process the information, and find faces other than places to get information other than Facebook and social media. You have time on your hands to actually read, go online, look at credible sources, and I think you will find some calming answers there that don't come at you, with typed all in capital letters, and telling you to go buy toilet paper all day long. But it's just a matter of trying to be informed, and to listen, and to just take 5 seconds to think before, and process the information before you scream and run.
And I also imagine that you have received a whole lot of inquiries about this, and some based on credible information, some based on false information, and I guess I don't know, do you have any sort of maybe recommended sources, or at least a sort of message that will keep people calmer?
I've done a lot of reading. I've read research papers. I've read newspaper articles. I've gone to see what the Belgians have done, what their national recommendations were. The Indians, the Americans, and there's certainly a lot of variation
Yeah.
around. The one theme that's been consistent has been distancing, which we're practicing this morning to an extreme. Um, in social distancing, I think that has been one constant. Therapy recommendations have been all over the map,
Yeah.
and this is new, and so all the information coming forth is new,
Yeah.
and some of the things that people are doing are you know are not quote unquote given the stamp of approval or have been FDA approved, because it is also new. But whenever you're combating a new fire, you have to begin somewhere, and part of that is offering people therapy that the test tubes say may work, and over time you will figure out what was the best thing to do, and typically you figure out the best thing to do near the end rather than at the beginning.
That's the truth. You know, it's interesting as you read all the information that comes out, and because we are still learning about this virus, it's not even 3 months old yet. Um, we're seeing changes in the messages as time progresses, and that's hard for people to be able to have full trust when they hear in the beginning, well, it's only the elderly population. Now we hear of more young people being hospitalized. We hear of differing fatality rates in different countries. And so people aren't quite sure what to expect because the information just keeps on changing.
I think although the information has changed, I don't think it real the some of it has changed, and I think we suffer sometimes from having incomplete information, and that makes it more confusing.
Yeah.
The younger population you speak of, and there have been increased hospitalization rates seen here in younger people. But if you dig a little deeper, you actually find that some of these guys were vaping. Although people don't like to think of smoking marijuana as smoking, it's still smoking. And so some of these folks who do things which can impact the lungs, they are affected more seriously by the virus. And this would be a good time to consider stopping smoking and vaping, as those things place you at risk.
Yeah.
So I think overall, when you kind of look and you see some of the new information or the new figures coming about, they don't really come with the asterisk that tells you why people were there.
Yeah, yeah. And just a lot of people know your face. A lot of people have heard you, have seen you in Belize. What would be your advice to Belizeans right now about ensuring that we do our part in flattening the curve?
I think the best thing would be continue social distancing, and listen to the directives coming from the folks up top. And although some of them seem extreme at times, these are we're living in a different time, and it calls for different measures. Although some seem drastic at the moment, and I think the sooner you can get control of the virus, then the sooner a lot of these measures can be lifted and people can return to a daily life that they remembered before the virus and before everything was closed down.
Yeah.
But reducing the spread, and by social distancing, and not placing others at risk, is the best way to get control of a situation, and beginning to get back to normal life.
Yeah. And to your patients who I'm sure are watching, or to people who are concerned about getting the next treatment?
You know, the center is open and available for you, and we continue our mission of providing cancer care to the country, and I think the worry that, you know, the next treatment might not be there, not true. We are there and the doors are open. I would ask that, you know, any family, friends, you know, keep our nurses, keep away from our nurses. We need them to be healthy and safe.
And if someone wants to start to receive treatment from the center, what do they have to do?
Simply contact the center, and there's some information we do need from them. That principal piece of information we do need. We absolutely have to have a piece of paper that says that you have cancer, and we will work with you from there and get you in the system as soon as possible.
All right. Well, thank you very much for joining us this morning, Dr. Grant.
Oh, no, thank you for having me, and you have a wonderful day, and stay corona-free.
All right, and you stay safe as well.
Thank you. Have a great one.
All right, and there we had it. That was an update with Dr. Ellsworth Grant, of course, from the Dangriga Cancer Center, talking about the risks, the level of risks associated with people who are receiving treatment, and the work that continues at the Dangriga Cancer Center. All right, we'll take that break now, and when we come back, our focus is going to be on the hotel industry with a representative of the Belize Hotel Association. So stay tuned.